Okay, welcome back and welcome to our Natural Fertility Care Seminar. As I mentioned, and you probably have seen on the website, this is a guaranteed program, and I'm going to go over today the big ideas. And when I say guaranteed, that is not some marketing ploy. What it is it's a commitment to find and discover and solve for you a problem. And if I can't, then I comp that treatment. That's as simple as it gets. And it is mainly because I really understand, I really get this cycle. I really get hormones at this point in my career and my education, and I'm ready to say it. I'm ready to say I can guarantee this for you, that we can allow your normal processes to occur by cleaning up the internal environment. So before I get into the big picture, let's just kind of do an introduction and what's going to happen in this seminar over the next hour or so. I'm going to introduce you to a new perspective. That is a way of seeing things, and a unique philosophy, a way of thinking about things, and a unique plan, which is a new way of doing things towards a unique solution, and a solution that really works. It is safe, it's effective, and it's natural. It is what we do, I call, or is called, functional endocrinology, and it is probably the most in-depth science of hormones and all the things that affect hormones, because we have to be good at your immune system also, and we have to be good at your digestion and everything that kind of plays a role in that. So it's a unique solution. It's a natural and safe and effective and really wonderful solution. And all that leads then to a unique reality, and we'll talk about that at the very end. So that's your game plan for tonight and your summary. So let's get right into the unique perspective. So if your body is not ovulating, not implanting, or for the men, not making sperm, is it broken? Is it broken, or is it choosing, for some reason beyond our comprehension, is it choosing to not allow these processes? And everything that happens in our body is a process. There is a process of thinking. Your frontal cortex has to light up electrically, and there's connections made to your limbic parts of your brain that pull from the associations, the things that you know, and the experiences that you've had, and how they felt. And so that every time you do any little thing, there's a process. When you take a bite of food, there's a process where saliva mixes in and starts to break down the food, and of course the chewing in the teeth, and the swallowing, and into the stomach, and the acid, and out into the small intestine, and the gallbladder releasing the bile and digesting the fats. It's a process, and making hormones is a process, and the 28-day cycle, give or take a few days, is a process. And so we're about diagnosing a process. So that's a little bit of a segue, but the big question here, the way of seeing things, is well, first I'll just say that I don't believe that the body is broken. It is choosing. It's choosing a path given a set of circumstances. And just to summarize and put it in total simplicity, the reason why it would choose is stress, toxicity, infection. Something is, let's make it even simpler, make it even easier. You're sick, you're weakened, or somehow you're not as strong as you need to be. And that strong could be, ATP, like energy strong, or hormonally strong in terms of your stress resilience and things like that. But somehow your body is calculating that you are not in a place, in a way that you can have this process take place. You just don't have the strength and the energy to carry and nourish and grow a baby. And same thing for the man. If in the wild, if a animal were injured or something like that, it just wouldn't be reproducing. And so we have to look at what those injuries look like. So the big point here is that survival trumps reproduction in any environment. And I have up here on the screen a picture of a cheetah chasing an antelope, and that antelope is not thinking about its wife. It's not thinking about sex or reproduction. It has a very focused attention right now and intention. That's to get away from the danger to its life, right? So stress, inflammation, and toxicity are the cheetahs in our lives. And when I say stress, I know that everybody has stress, and some have more stress than other people, and it's all about what's going on that internal environment. What changes in your cortisol, because some people will have tremendous stress in their life, yet their adrenal glands are strong and nourished, and there's not a hormonal change. Whereas other people may have what many people would perceive to be less stress in their life, but their hormones are really high or low, or something is going on with their stress physiology. And it is a cumulative effect. It could be other issues like anemia. Anemia is very stressful to the body, so if you're anemic, your capacity to take more stress in your life is diminished. Inflammation and toxicity are the other threats to survival in our life, and those are broad categories, but we can look at the research and the literature behind that, and it is proven, it is shown that stress, the hormone cortisol, dampens your ability to create luteinizing hormone, which stops the ovulation and implantation process, and primarily the implantation. Inflammation dampens gonadal function, toxicity. Right now we're dealing with tons of estrogens in our environment from the plastics that we made this a plastic world, and there are consequences. I've seen studies that show that men have 50% of the viable sperm that their grandfathers did on average, and it's kind of associated with this toxicity, the plastics and things like that. So if those things become overwhelming to our system, then it's just from an inside out level, there is no there's no possibility of naturally creating an ovulation and a pregnancy when you're being attacked like that on some level. And most people will say, hey, I don't feel like I'm being attacked, and I don't feel like I'm totally stressed out. In fact, I feel pretty good. And there's a couple different avenues I want to take on discussing problems. One is the accumulation of problems that are minor, and the acceptance of them. Most people who are 40 years old would probably agree that 40 means a bad back. Statistically speaking, that would be true. There's at age 50, we might say that low libido is a very common characteristic. So I want you to just kind of think of yourself right now, and let's talk about some of the most common symptoms that go accepted. They don't go completely unnoticed, but they're there, and everybody has that, and so they're sort of accepted. And probably the number one is hypoglycemia. How many people do you, let's just speak directly to you, do you have the experience of, if you're late for lunch, if you're late for dinner, or if you miss lunch for some reason, you go insane? You get jittery, shaky, irritable, dizzy, nauseous. That is not a normal experience. That is not the normal signaling for hunger. That is a dysfunctional drop in your blood sugar. The normal signal for hunger is hunger. The normal signal for more food is hunger. And another very common one associated with that is insulin resistance, or elevated blood glucose after having eaten, and that looks like the fatigue and exhaustion you get after a meal. So you chow down on your lunch and you go back to the office or wherever, and you're falling asleep on your elbow. You're watching the presentation and your eyes are, your eyelids are so heavy you can just barely keep them open. That is insulin resistance. That is not a normal, oh, I just had a really good meal, let me fall asleep. That is not a normal process. One of the partners of insulin and blood sugar is your cortisol, which is from your adrenal glands, and we talked about that with stress, or mentioned it. And one of the common symptoms of high cortisol is inability to fall asleep, and we should be falling asleep within 7 to 10 minutes from putting our head on that pillow. And do you, just kind of turn the attention to yourself and kind of self-assess, do you have that? Are you not falling right to sleep? Or do you, worse, you suffer with insomnia and you lay there for hours and hours a lot of the time? Or one of the results of low cortisol, or one of the effects or problems, as we might call it, of low cortisol is waking up at night. So you go to bed soundly and quickly, and about 2 a.m. you wake up, or 3 a.m. you wake up and you can't get back to sleep. You have a symptom, and your symptom is insomnia. Now, the other thing I want to address here is, again, a big picture concept, and I talk about the big picture concepts in my book, which is titled "When Did Natural Become the Alternative?" And this big picture concept is a problem really a problem, or is it a signal? Or is it a message? If you have a symptom, let's go back to insomnia, for example. What does that mean? What is it trying to tell you? Is it, again, you're broken? Or is it really have more to do with your body trying to create the best opportunity for survival and thriving, and then reproducing? If you have survival and self-thriving handled, then you can go into reproduction, and that's just pure hardwired neurology and physiology in your body. You can't go into reproduction if you're not yourself thriving, or if there's a threat to survival. So let's take insomnia, and I'll take a few of them just to kind of give an example. So what does that mean? What does that mean if you have insomnia and you're waking up in the middle of the night? Well, when we understand physiology, the problem occurring is that your blood sugar is dropping. And normally your cortisol helps to stabilize your blood sugar through the night, and that keeps you resting soundly because there's no threat to survival. But if your blood sugar drops, really 80 to 95 is a good normal range while you're fasting, and if it's dropping to 75 and 70 and 65, your body is starting to go into a survival mode. And so it's waking you up so really you can eat. Although eating is not generally the problem, it's an imbalanced diet that does that. Let's just take, what else? What other problems do you call problems? And let's look at them. So how about low energy? What would low energy mean? Low energy would mean that you need to sleep. For one example, it might also mean that there's low oxygen. So if you're waking up and you have no energy and you have no energy all day long, you could be anemic. So that lack of energy is saying that really you're sick. Your body is sick and weak, and it doesn't tell you, hey, ring the bell and say, hey, eat, more iron, or eat more B12, or you have a yeast in your gut that's absorbing all your B12 or using up all your B12, and so you're not getting any and your red blood cells are starving. It doesn't say it exactly like that. It just says, hey, I'm showing you that you're tired. Figure it out. But rather than figure it out, because that's not how our doctors think, and so that's why this is a whole different philosophy. This is a whole different way of thinking. Instead of figuring it out, we have coffee. Because if you go to the doctor, what is he going to tell you? Well, your thyroid's fine, so, I checked your TSH, and, let's see, I checked your CBC, and you're not anemic, and, case closed. Like, he doesn't look any deeper at your adrenal gland function, at the whole cascade of thyroid function. There's more than just a TSH to thyroid. So, what do? We got to figure it out ourselves, and what do we know? We go get, an espresso, and now we have some energy, at least for a while. How about high blood pressure? High blood pressure is a problem, isn't it? Or is it a message? What is it trying to tell us? High blood pressure might be trying to tell us that, again, there's low oxygen, so it's trying to move blood around faster or squeeze it to the center. So like if you have a limited supply of oxygen, your body's going to say, okay, we're going to focus on the heart, because the heart uses oxygen, right? Every cell in your body uses oxygen. And we're going to focus on the brain. Those are two pretty critical things that we need to supply with oxygen. So too bad arms, too bad legs. Yeah, you're cramping up at night, I hear you, I got you. But you know what? We only have enough oxygen for the brain and the heart, and we just can't afford anything else. So is it a problem, or is it a message telling us? How about a headache? What might this message for a headache be? What would be the message that your body's trying to send? We sure see it as a problem. We treat it like a problem. We treat it, let's get the headache blocker pills off the shelf and block that headache because we have this problem. But what if we thought of it as a message? What would be the message? Well, there's a number of things. There's a lot of things that could potentially cause that message to us. Toxicity. It could tell us that our blood sugar is dropping really low again. The drop in the blood sugar causes an increase in cortisol, which has an effect on constricting your blood vessels. Cortisol also has an effect on your hippocampus, and that's a big word that means your memory area of your brain. So you walk into a room and you forget why you walked into a room. Now, everybody does that on occasion, and everybody has a stressful day. If that's happening to you on a regular basis and you're accepting it, you're missing a message. So, from a headache, we talked about a couple things there. So what I believe is really going on in your system through this problem orientation, through experiencing these problems, is that your body is adapting to a set of circumstances. Low oxygen, constrict arteries, save heart, save brain. It's adapting. And it's sending a message in the form of a symptom. So that's a very different way of thinking about life and our health. So that's a little bit like what Albert Einstein asked us. He said, answer this question first. Do you live in a hostile environment, or do you live in a friendly environment? All else will change after you answer that question. That kind of sets the tone for everything. So when we look at this, do we live in a broken body, or do we live in a perfectly organized, functioning, adapting body? And how we treat ourselves will change with how we answer that question. So the first question, again, this is kind of a big picture concept, is in medicine, really, we say, how do we make this happen? So if you have heartburn and you don't want heartburn anymore, you say, how do we make that happen? Or in this case, kind of not happen? And, well, acid blocker, let's do an acid blocker. Okay, so same thing with fertility, is like, how do we make this happen? And they get into some pretty heavy hormonal therapies that have tremendous side effects. I don't know if you've looked into that or how much that's minimized. I've never experienced medical infertility care, so I don't honestly know like how much that's minimized or how much it's expressed, that this is really a dangerous process to be hyper-stimulating your pituitary gland to produce follicle-stimulating hormone and luteinizing hormone, or to give those hormones outright and just really rev up your entire endocrine system. Or we can say, what will allow this to happen? What are the barriers, and how do we get around those barriers? How do we get through those barriers? This probably wouldn't be a good thing to try to get through. We might want to get around it or remove it. So it's hard to find a good, perfect analogy for what's going on in your system, but we're going to talk about what some of those barriers are. And do we want to just try to plow through them, or do we want to figure out a way to remove them? And in the case of your body, it's not going to require a huge crane to make change. It's not going to require this huge thing. It's going to require working intelligently, not forcefully. We are going to allow this to happen. So again, very important question. This is the first question that doctors ask. And it makes a complete difference on how they approach your situation. And then as they move forward, what is the focus and the intention of that process or of the plan? And in medicine, it's really single-minded: egg, meat, sperm, and then douse with progesterone. So we get the two together, we get them in the right spot, and then we just pummel it, douse it with so much progesterone that it can't not hook into there. You're just so pushing that process, making it happen. That is the single-minded focus and intention with medical infertility, with functional endocrinology, our whole process is about restoring the normal cycling, which you could even say is really a process of decreasing the stressors in your internal environment. And again, like I said, we all have stress. We all don't have changes in hormones that are reflective of that. And many internal changes like anemia cause stress themselves. So we're looking at, really when we're talking about decreasing stressors, we're talking about getting more oxygen, getting more energy, reducing activation to the immune system, balancing hormones, all of those things are internal stressors. So if you have, a half dozen things that are shifted this way and that way from their normal regulated positions, and then you have a visit from your mother-in-law, you can't take it. You just don't have the capacity to withstand more stress. And just there's a good self-inquiry right there. Is like, what is your stress capacity? Take a look at that. Like, do you feel into overwhelm or into shutdown with something like a visit, with something like bad news? Chances are your stress physiology, there's a good analogy that somebody used years ago that said there's a bucket. We all have a bucket, and some of us have bigger buckets than others, but the problem is more that most of us are walking around 3/4 full in terms of their stress capacity because of the internal stressors. And then we only have like a 1/4 bucket or even less to deal with life. And that's just not enough because life comes at us hard and fast. There's a lot to take in. So I'm sure I don't have to explain that to everyone. So here's where we get into the science. This is where we get into the plan. This is the 7 critical components. The critical components for ovulation and implantation. For having a baby, this is what has to happen. Now, from a medical perspective, lack of ovulation is the problem. From a functional endocrinology perspective, what causes a lack of ovulation or a lack of the ability to implant? So I'm going to try to use my pointer here and take you through the process. And if we go all the way over here to the end, you'll see at the very end all these hormones drop. And that is right before menstruation. Those hormones go down. That's actually the first step to your normal cycle and to the ovulation and implantation cycle. So your hormones have to drop at the end of your cycle. The higher these hormones are towards the end here, usually the worse your premenstrual tension is, or premenstrual dysfunction is. So if your hormones are up here. The drop in hormones is what stimulates in the pituitary a rise in follicle stimulating hormone. So this causes this, if we're looking at that. The drop in hormones causes the rise in follicle stimulating hormone. Follicle stimulating hormone communicates messages to the ovaries to increase estrogen. And as estrogen rises, it starts to, form a little bit of a mountain, and it peaks at when it hits a certain level, a certain threshold, it causes a feedback into the pituitary to cause a surge in luteinizing hormone. Now that little process right there causes ovulation, the peak of estrogen and the spike in luteinizing hormone. And that's this one right here. That spike in luteinizing hormone then causes the progesterone to surge, preparing that uterus for implantation. And then right in here, somewhere after ovulation, a few days, we have fertilization, and then instead of dropping these steroid hormones, they actually both climb, and that's signaled by fertilization and implantation, and then you get a new process. So now you have something completely different going on in your body. So those critical components have to happen in order for you to ovulate and implant. Does that not make more sense than you don't ovulate, let's force ovulation? Here's some hormones. If that doesn't work, we will do an in vitro, an in-lab fertilization and implantation, and then douse you with progesterone, and we'll probably do a lot of those hormones anyways, because clearly, we need all the help we can. A $10,000 to $15,000 IVF is only about 20% effective. So we're going to do everything in our power. We're going to do the Clomid and the gonadotropins and the you name it. Blah blah blah. Let's create. Let's allow your cycle to work properly. Now, at every step of the way, there are herbs and plants that will create this. So for our follicle stimulating hormone, there is some research that says that the herb tribulus, again, if you haven't heard of that, don't fret. It's just a name of an herb, of a plant, but that increases follicle stimulating hormone. It helps your pituitary to produce those things. Along that whole process, there are plants that will allow or stimulate those glands to produce. But here's the problem. Here's where most people get stuck. You cannot stimulate those glands if there's a survival process keeping them down. Not with a hormone, or not with a plant. But if you then search the stressors and you find that and remove that, these plants work incredibly well. So well, obviously, that I'm willing to guarantee this process, that we can make this happen for you. We can make this map for you. So here's the 4 deal breakers. We have to look at your insulin levels. We have to look at your cortisol levels, your inflammation levels, and we have to look at the level of your immune system and the balance of your immune system. And I'll get into that to a greater degree in another video or another, but I'll give you the summary here. Is that each and every one of those causes a survival sort of signaling inside your body, and I'll also kind of show you how we do those tests. So here's the party, and here's the party wrecker, and that's what these are. They're the deal breakers here. So what's the big deal in this? Why wouldn't you want to just go ahead and do the assisted reproductive techniques? Because the things that we're talking about, the hormone imbalances, the four deal breakers, lead to significant mortality and morbidity. These are the things that cause heart attacks. They cause chronic diseases. They cause disability. So this is more than just a family issue in terms of creating a baby. This is a health issue. You do not want to be forcing a baby on an unhealthy body. So that's the big deal. If some of these numbers are off, if you have high insulin, well, good luck on kidney dialysis when you're 60 years old. If you have high C-reactive protein, I hope you survive that stroke. If you have high levels of cortisol, enjoy the Alzheimer's. There are direct correlations to these chronic diseases, and of course, prior to those diagnoses, do you think the day before somebody gets diagnosed with Alzheimer's, they're out skipping around the lake on their sailboat? No, they're on a downhill slide towards the worst case scenario. So if you want to enjoy your life and your child and your grandchildren, this has to happen. You have to take care of your body on this level. Okay, so we're going to just touch on the diagnostics. So how do we look and see? That's my sense of humor there. CSI Gonadville. We're examining the crime site in the gonads here, so that's boys or girls. So baby wanted Inquire inside, and what that means is that we have to look at that internal environment. And that includes looking at the full hormone panel. And most people have never even heard this concept, but what we do is a saliva hormone assessment where you take samples every other day for 28 days. So we get a view on every one of those shifts. We want to see the bump here and the drop here and what that does to the next step and the next step. And we want to see each of those 7 critical factors, which you cannot do with a single estrogen level. And that's one of the diagnostic things that are used in medical infertility is they do the day 3 follicle stimulating hormone and progesterone, I think it is. And that's the basis for their care right there. Oh, well, that shows that you're not ovulating. Here's how we cause or create or force ovulation. So, step 1, and then if that doesn't work, then we're going to do that, plus we're going to just stick it in there. So we look at your entire immune system, because the main cause of low estrogen and low progesterone, short of the lack of the step before them. So one of the problems that would result in low progesterone is the step before it didn't happen. So you've got to look at the step before it. But if that's happening independently, then we're looking at an immune process and possibly an inflammatory process that is basically saying, that's really a survival instinct of shutting down that production. Because it's busy doing something else, right? All the energy in your body is busy doing something else. And I can tell you this, that many people, if not all of the people, that we do the intestinal immune system assessment and we find infections, they have no idea. They might have some of those acceptable symptoms or signals or messages, but they don't have, the slightest that there's something seriously going on there that is constantly affecting their immune system and ramping it up and activating, and has their entire internal environment in a state of stress and survival. The adrenal stress index, so we can actually gauge how impacted your stress system is. So there's a normal adrenal stress profile, and that's your hormones are high in the morning, they're low at night, and through the day after you eat, you're pretty low, and they climb slowly through the night, and they're high in the morning, and they wake you up, and you eat, and they go back down, and they're low at night, so you can go to sleep, and then they climb, and that climb is helping you to regulate your blood glucose because you're fasting at night, and then they have breakfast, and you drop back down. That's normal. And then there's going to be a hyper response where everything is going too fast. And then if that too fast is on too long, or if it's the type of internal stressor that will shut your adrenals down because it needs you to go to bed or wants you to go to bed, such as an immune process, some immune processes obviously shut things down. Some stress processes speed things up. So we see what stage of adrenal stress are you in, over-responding, overactivation, or into fatigue, exhaustion, or total adrenal failure, or shut down. We measure several levels of inflammation, high sensitivity C-reactive protein. Again, don't fret, that's just a big name for a lab test. What's important is that lab test indicates how inflamed your system is. We also do sed rate, fibrinogen, and another one called homocysteine. All those stressors, which would be toxicity, glucose regulation, oxygen concentration. So we got to look at the basics here. We got to look at your nutrients, which is your protein, your fats, your glucose is the macronutrients. The micronutrients are all your electrolytes. Your electrolytes really set the tone for your nervous system. They are managed through your endocrine system. We got to look at all your B vitamins, possibly oxidation, and one thing I didn't put on here specifically was the liver toxicity test, and that'll tell us how overwhelmed we are with things like plastics and things like estrogen that our body has to bind and remove. So that's it. I mean, we look at those things. We look at them functionally on you know, what's your cycle look like, and for the men, we just have to do a 1 day, you know, testosterone, estrogen, progesterone. We got to look at those levels, the ratios, and things like that, and how they're converting into DHT. And again, that's a little more complex than what's intended for this class. But it's the same concept. We have to look at what the levels of ratios are, and then look at the stressors. We got to look at the deal breakers. And we have to be good detectives. We have to look at all the clues, and we have to put it together and come up with a plan. And that's how we do things. So once we find out what the ABC problems are, and what deal breakers are being activated, and what stressors are in your internal environment, we turn to nature. We use our knowledge of nature, such as let me just talk about a couple of the I don't know, a couple of the studies that I think are dying to reach the public ear or eye. And one is for type 1 diabetics, where there is no insulin production out of the pancreas. Like, most diabetics have high levels of insulin. Type 1 diabetes and other types of blood sugar problems, they have a lack of insulin. They don't produce. They're basically, it's called a beta cell exhaustion, where there's no production from the pancreas. There's an herb called gymnema that has been shown in clinical studies to not only increase the production, but to regenerate, not only to regenerate the pancreas. They actually cut out the pancreas of some animals and then gave them this extract, and they were astounded to find that the insulin levels started to return to normal, the blood sugar levels started to return to normal, and they dissected the animals, and they were like, holy cow, this is growing the pancreas back. And so I think it's, you know, on the level of criminal that this kind of information isn't public knowledge. Another one that is a little more specific, although that is specific to fertility, because probably the #1 cause of infertility being polycystic ovaries and the hormonal changes that are associated with that, is majorly an insulin problem. So we have to know how to handle insulin in order to treat polycystic ovaries. That study is on the American Diabetes Association website, buried deep in their archives. Obviously, if that were public information and proven true, the metformin industry, the pharmaceutical, there'd be a huge impact on, you know, if you cured diabetes. Oh, anyway, I digress. One other thing that I wanted to mention, and this is actually something I more recently found out about, but it was through a doctor who was specializing in fertility treatment and on the natural end of things, although he does IVF for you know, structural problems and things like that. With abnormal PAPs and positive HPV testing, and he actually sent me this study. If you use extract of broccoli and asparagus, you can eliminate the abnormal pap and eliminate the positive HPV test. He said it has worked at 90% in his office in 2 to 3 months. And he said the only reason he says 90 is because 2 or 3 patients, it took them 5 to 6 months on that protocol, and they were then HPV negative and normal pap smear. So again, the world of plants produces these amazing healing substances, and we just have to have the knowledge to use them, and then truly apply them in a clinical setting where we're doing pre and post lab testing, so that we can see, like, you know, if you're just at home and you're like, geez, I went to my doctor and had abnormal pap, and you start on these things, you wouldn't know if it was working, you know, necessarily, because, like, what's the symptom of an abnormal pap? Those things are things that come up just arbitrarily, right? You know, you're having your regular tests, you're not complaining of anything necessarily, and there it is. And then another nice big picture concept is trusting that process, trusting the process of the body can heal. It is a perfect physiology in adaptation. It's doing the best with the circumstances. And then checking the gauges really refers to looking at those lab tests over and over and making sure that our natural treatment is moving you in the direction. I always use the analogy of, if you jump in the plane to Hawaii from Asheville, your pilots are checking the gauges and readjusting. You know, let's do a little bit this way and a little bit that way. And that's what we do in our process. It's just a natural process. Anytime anybody has accomplished anything, they had some set of criteria to know whether they were getting there or not. And that's what we use the lab tests for, is to know that we are moving you towards a place that will allow normal fertilization and implantation, ovulation, the whole process. We're going to allow that process to happen. Obviously, there's, you know, a couple things that you have to do in that process, but, you know, that's kind of nature's course too. So, and this leads to a new reality, and that's really what I want for you, is this natural, gentle success, which is, you know, just this process of moving your body from dysfunction to function. Maybe you don't feel sick, and, you know, maybe when we talked about the symptoms, you're like, oh yeah, I do have that. But we're moving from a dysfunction to a function. We're moving from the pain, you know, whether that's the emotional or just the whatever, towards this happiness, this fear to trust. And that entire process is just a new reality that that I'm bringing at a new level to people in your situations, helping you, you know, trust yourself once again, because we're not born like, you know, we're not born with this distrust and this, you know, belief that we are these broken things. That's not how we come into this world, and it's really trained into us via the media and the culture itself. And I think this is an exciting new reality. And I know that, you know, you're going to turn this off and you're going to go home, and the doubt is going to set in, you know. But, you know, we only have so much money to spend on this process, and, you know, the way things are this assisted reproduction, and the doubt is going to creep in that, hey, this natural process, I don't know, what's the track record and how does it's just, that's not the way things are. And I just want you to remember, I just want you to know that I have faith in you, in your body. I have tremendous faith in soothing, stimulating, taking out the barriers, the obstacles, that you can have this process happen naturally, healthfully, if that's the right way to say that. And I really want you to have that experience too. Not for any selfish reason, only because it feels so good. I mean, I've had 4 babies now. Sonia's actually did the hatting of them. But we have 4 babies, and each one was this, it was fairly fearless. It was very trustful. And it was really extraordinary. And I want you to have that experience if I can do anything about it. So just remember that. I have the faith. You can too, as we go through this process. Okay, so please email me the questions that came up. Write them down right now and email them to me, because this is too big, this is too important to let it go, to let it pass and go back to the way things are in medical infertility. There's just too much at stake here. I know that this isn't for everybody, that this isn't going to speak to everybody, that some people are actually too afraid to even consider this possibility, that their medical doctors are their saviors and the only symbol that makes them feel safe. And that's okay if that's you. It is really okay. I wish there was something I could say that would help you have more trust in your body and trust in nature and what it can do. I guarantee my process. I guarantee my results, safety and effectiveness. And I will take whomever this speaks to and help them have the most amazing experience possible. That I promise. Thanks for your time. This is Dr. Stone.